you are 37 to 68% more likely to lose your hair on GLP-1 drugs that help you manage diabetes. In July 2026, researchers at the University of Pennsylvania published a study in the BMJ. They studied roughly 12,000 people who started a GLP-1 drug like Ozempic or Mounjaro and found that these people were 37 to 68% more likely to develop hair loss than people on other diabetes medications. This relative risk sounds alarming, but when you look at absolute risk, you're looking at 7 people per 1,000 GLP-1 users per year getting diagnosed with hair loss, compared to 4 or 5 per 1,000 on the comparison drugs. That's statistically significant, but the absolute difference is small. Moreover, this study is an observational analysis, not a randomized trial. It shows association, not proof that the drugs cause the hair loss. To be historically accurate, hair loss or alopecia was already listed in the FDA-approved label for Ozempic since early 2025, but it was listed in the skin and subcutaneous tissue post-marketing adverse reaction section, not a boxed warning. This may explain why awareness of the effect on hair loss may have been low. What the study really did was provide systematic evidence and hard statistics of a side effect this specific. So what's actually happening to your hair? Experts believe that rapid weight loss and a sudden drop in calories can push a portion of your hair follicles into a resting phase all at once. Doctors call this telogen effluvium, a non-scarring hair loss where hair follicles are not permanently damaged. It's the same shedding pattern seen after crash diets, major surgery, or even a bad flu. Your body treats fast weight loss as a stress event, and hair is expendable when resources run tight. The result is usually reversible shedding that peaks a few months after the stress begins, and then reverses when your body adapts. This explanation is most plausible at the moment, but it still needs to be verified for GLP-1 drugs. Lastly, even this study leaves a gap. The research focused exclusively on people with type 2 diabetes. It tells you nothing definitive about the larger group of about 40 million Americans who have taken these drugs purely for weight loss. More research will be needed to address it. The new study makes the hair loss signal harder to dismiss, but it still doesn't answer the most interesting question. Are GLP-1 drugs affecting hair follicles directly, or is the hair loss a consequence of rapid weight loss and the physiological stress that comes with it? If you have enjoyed this story, please watch this other video discussing gelatin as nature's Ozempic.